Dr. Phoebe Juma has been on the front line attending to COVID-19 patients from March. Every single day, she wakes up intent on easing the pain of patients battling the infectious virus.
On average, a ward round lasts around anywhere from 3 to 4 hours. We are limited as clinicians in terms of what we can do because, working in this uncomfortable clothing, the examination, your ears are covered up. As a clinician, the equipment that you can use to examine a patient is limited.
Working in the infectious disease unit, especially now, is no easy task. She fights to save the life of every patient who comes here, but at the back of her mind, she knows her safety and that of her family is also on the line.
It has been a challenge working here, at least in the beginning, because of course of the fear of being exposed. We're not used to, we've never done anything like this before. We're not sure whether the equipment will really protect us, whether we'll be infected like our colleagues in Italy, whether we'll die and leave our children destitute.
For infectious disease physicians, the nurses, cleaners and anyone working here, personal protective equipment PPE is mandatory. Around in the wards demands a full set of PPEs that is only worn once.
Once we plan for the patients, then everything is set. All the supplies that are supposed to be used are put together before the staffs go in and start doing the nursing care. The average stay in the ward is also limited because of the kind of personal protective gear that we wear. It will always require one to take the shortest time possible, but you do every work that is required.
Dr. Juma herself was infected with COVID-19 in June. Luckily, she was asymptomatic, but had to self-isolate at home. This is after health authorities had announced home-based care as a preferred alternative, especially for patients with mild or no symptoms.
So even if I was not severely ill, it was not a good experience. There's a lot of stigma attached to this illness, a lot of fear, because you see, you don't know which one of us will be okay, which one of us will be very sick. You keep waiting, maybe for the cough to start, for the difficulty breathing to start. Yeah, so it was a worrying experience. You're afraid you've spread it to others. Maybe will your family need to be hospitalized? Yeah, will they be very sick?
I asked Dr. Juma what her highlights during the intense 8 months here have been. She says her joy is seeing a patient fully recovered and getting discharged. But sadly, that is not always the case.
You can't afford to give up. Yeah, who will be left to take up that burden? So I think what I try to do is to look at the positives, like how many have we helped? And always for patients who are very sick, even those who succumb, what you do is you make sure you've made your best effort for that patient.
Currently, there is no known treatment for COVID-19. What they use here is simply meant to treat the symptoms and keep the patient stable.
There's an injection that we give on a daily basis, because patients who have COVID have a tendency to form blood clots, but again only for hospitalized patients. So for the people at home, if you're in isolation at home, maybe just keep active. Yeah, you don't need to take so many things. There's so many things on social media, so many concoctions. But so long as you just eat your healthy diet, you should be fine. But if you develop symptoms, of course, then you have to come to a facility.
In cases where patients have breathing difficulties, which is most prevalent here, they have to administer supplementary oxygen.
For the people who are severely ill, those ones require anything from 10 to 15 liters per minute of oxygen.
Per minute?
Yeah.
15 liters per minute? Yes,
of oxygen. Yeah. So it's a lot of oxygen, and you see when they are very sick, they stay for several days on that oxygen.
At the hospital's pharmacy, we are shown an assortment of drugs used on COVID-19 patients. They range from antibiotics to endocrine cluster of medicine. Josiah Otieno, the pharmaceutical technologist, walks us through the common drugs used on pain, shortness of breath, clustered chest, and sugar-related complications and other comorbidities that are associated with COVID-19.
So whenever a patient represents with any issue, we sort them based on the symptoms that they present. So we have the analgesics, and that's why you can see we have our analgesics here. And for any case where a patient has got any pain or any sort of weakness, we can give them the analgesics that are available. We have medicines that affect the nervous systems. They are as you can see, that's how they are arranged. And we have medicines that are for cardiovascular systems. We have the naloxone, amlodipine, all that. We stock them, and whenever a patient presents with any case that requires that, we have the medicine that are necessary to help us.
For doctors and other health workers working here, it is a delicate balance of duty, always striving to save the lives of patients and ensuring their own safety from a disease that has already claimed the lives of 11 senior doctors and at least 20 other healthcare workers.
The moment you leave now there.
In part 3 of Tales from the Frontline, we bring you journalist account of the COVID-19 wards, from our preparation to access and what we learned after interacting with severely ill COVID-19 patients. Elfas Lagat, Citizen TV, Nairobi.